So how can the cardiologists and the PCPs and the endocrinologists all get together on the same page here with the same recommendation?
You've just done it. We're actually all on the same page, Peter. And I think really it is. I think it's recognizing that it's actually not just the specialists, it's the patient. And I think the patient is the center of all diabetes management. And I think reflecting that each of us brings different skill sets, each of us brings different knowledge. And I think working together as a team with the patient at the center of the team will give us some optimism about making positive impact.
I mean, that's encouraging.
Yeah, but that being said, I think now more than ever, the cardiologists and the endocrinologists need to be constantly working together and in communication.
Completely agree.
I mean, I can remember when I first heard the statin data, it was at the diabetes meetings. And it was that Nissen actually presented some of the early stuff in diabetes meetings. And when I went to the endocrinology meetings, they hadn't heard yet. And the cardiologists kind of knew, but didn't kind of know because they weren't interfacing. How do you make the interface?
Yeah, I mean, I think this is, we, like all things, I think we had these two different fiefdoms, and you had cardiovascular disease, and we were worried about the atherosclerosis, and then we had endocrinology that was worried about managing glycemia and the microvascular and the nephropathy and the neurologic issues. But now we realize that's a totally arbitrary distinction, and the companies, they've combined the two and they call it cardiometabolic.
Right.
But these patients, they're all the same patient, and their abnormalities and their metabolic dysregulation and their coronary disease and their heart failure, they're all intermixed. And so I think that now we're actually all talking about the same thing, and rather than just focusing on management of glucose, which the cardiologists totally abdicated because the endocrinologists are the only ones who could figure it out. Now it's a team effort, because now we're potentially prescribing drugs not necessarily to manage their glucose, but to
Manage
identify their risk of heart failure, their risk of MI. And so then I think when you're getting to this patient level focus, that's where you need the primary care doctor, the endocrinologist, and the specialist.
Yes.
So in the future, you see more of this, more collaboration, more integration?
We have to. We have to. We don't have any other choice.
The human body doesn't say, well, no, I'm going to get this far, but that's a cardiologist problem from that point on, right?
Right.
And what do you read, by the way? What papers do you read? Do you read from all these specialties, or?
I only read my literature. No, I think, I mean, there is primary care literature, and I think it's directed to us, but I think we obviously, sort of landmark trials are read. I'm actually the editor of the ADA's Clinical Diabetes, which is the primary care journal of ADA.
That's what you read.
That's what I read. I have to read that one. But I think the point is that the important studies do get out to all of us, and I think that's part of the thing, is just being aware of that. The problem is in primary care, we're not just managing diabetes and cardiovascular disease, we're managing broken legs, we're managing everything. And so really sort of condensing this down to very practical import. And that's why your program, Peter, exactly. This is
you've got to boil it down. So, we have come to the end of this portion of our discussion, and we could go on for hours more, but they won't let us. What I'd like to do, though, before we leave, is ask each of you to sum up something that you'd like our viewers to take away. And Dr. Brunton, why don't you start?
Well, you mentioned that you've been managing diabetes. You've been managing patients since the sort of the giants roamed the earth. I've been managing diabetes since all we had were leeches. So it's a very exciting time to be managing diabetes now. We have so many different agents. We have so much greater understanding of what diabetes is. And now with the impact of the cardiovascular outcome trials, it gives us much more opportunity to both work with our patients, develop an intervention that's going to not just reduce their blood sugar, but also reduce their overall risk.
All right, Dr. Lajara.
I think I would add to that we are at a very unique time historical perspective in the management of diabetes, and we can impact other metrics other than sugar. So I think it takes a village, and it's time that this village can work together, because now we have the agents that have commonalities for the different specialties.
Dr. Ruff.
Yeah, I think this is really a transformative time in the treatment of diabetic patients, because I know on the cardiovascular side, it's been decades of frustration where we try to, as aggressively as we can, manage their glucose, but these patients are then ravaged 10 to 20 years down the line by heart attack, stroke, and heart failure, and we had little to offer them. And now all of a sudden, in the span of 2 years, we have multiple different drugs, different classes, that have profound effects on how long patients live and the quality of their life, reducing heart failure and atherosclerotic events. And I don't think there's ever been more optimism about treating patients with diabetes, not just to control their diabetes, but actually to impact their lives 4 decades.
And Dr. Watson, the last word.
Well, I agree with what everyone has already said. So I'm just going to end with also, it's a new day, a new bar. Cardiovascular mortality has to be considered when you're treating diabetes. But I don't want us to ever forget there's always going to be the other thing. Patients have to feel better, and their quality of life is important. So we can't ever forget that as well. But I agree.
Or else they won't even take their medicine.
They won't even take their medicine. And again, if I tell you you're going to gain weight or whatever, they're not going to do it. But it's certainly an exciting time.
What a terrific discussion. I want to thank all of you for being here. I want to thank you for watching as well. I'm Dr. Peter Salgo, and on the behalf of MD Magazine, I want to thank you for joining us, and I'll see you next time.